Hello, Kim. Can you hear me and see me?
Yes, I can hear and see you.
Hey, great. So stop this for a second and
Thank you. Thank you to everyone who has joined us so far. As a reminder, if you plan to ask a question today, please identify your media outlet to me in the chat. Thank you. Good afternoon, Dr. Ferrer.
Good afternoon. Ready to go.
Wonderful. Let's go ahead and get started. Good afternoon, everyone. Thank you so much for joining us today for a media briefing. Today we have Director of Public Health, Dr. Barbara Ferrer, presenting. After Dr. Ferrer will take questions. As a reminder, you can use the hand icon to ask a question, or you may chat me, the host. Dr. Ferrer.
Good afternoon, everyone. And again, thanks a million for joining us. I appreciate the opportunity to once again share our latest update on the COVID-19 pandemic and to answer your questions. In today's briefing, I'll share our current metrics, several maps to show what we're seeing with COVID-19 spread across the county. I'll also present the latest vaccination coverage data and provide some updates on schools. We'll revisit a little bit our post-surge planning, which I discussed last week. And finally, I'll just close out with reminders about how all of our football fans can safely enjoy this week's activities around the Super Bowl and obviously Super Bowl Sunday. We'll take the first slide. Over the past several weeks, I've been reporting encouraging news that our cases, test positivity rate, and hospitalizations were all starting to decline, and I'm happy to share that this week the downward trends have continued. As our metrics are improving, we're developing this post-surge plan, which will guide how we'll continue to mitigate the risk of COVID-19 across the county after we've moved out of our winter surge. This will realign our current public health response strategies and requirements to meet current mitigation needs. Since our metrics reflect how we're doing with controlling COVID-19 spread, preventing severe illness and death, and ensuring adequate healthcare capacity, they'll be key to our post-surge approach. For instance, we'll consider LA County to be out of the surge when we have fewer than 2,500 hospitalizations for 7 consecutive days. In addition, we'll base some of our post-surge modifications, such as changes to masking and vaccine verification requirements, on what our current level of community transmission is, as reflected by our case rate as defined by CDC. Of note, I want to emphasize that post-surge does not mean the pandemic is over, or that transmission is low, or that there will not be additional unpredictable waves of surges in the future that will require integrated public health measures. Rather, it acknowledges that we're stabilizing with consistent declines from the surge peak, and it realigns our current public health response to meet the current mitigation needs. With that in mind, we can just start reviewing these current customary metrics that we share every week. Several weeks ago, we did hit the pandemic high of 46,000 new cases reported in a single day. And today, as you can see, we're reporting a much lower number, 6,276 new cases. The average number of daily new cases reported over the last 7 days has dropped to approximately 7,500 from about 15,600 the previous 7 days. And since last Thursday, our average daily case rate has dropped to 74 new cases per 100,000 residents, and that was at 154 new cases just a week ago. Our daily test positivity rate, which is the percentage of all COVID-19 tests performed that are positive, has also continued to drop. Today, our 7-day average is down to 4.7% from about 6% a week ago. While these declines are important signs that community transmission is continuing to slow, the numbers and rates themselves indicate that LA County is still in a period of high community transmission, as defined by the CDC criteria, and we'll need to stay focused on the strategies that can reduce that transmission. The number of people needing to be hospitalized due to COVID-19 has also continued to drop. Over the past 7 days, there were an average of about 2,800 daily hospitalizations. That's compared to 3,800 for the prior 7 days. And for the first time in several weeks, our daily hospitalizations have now dropped below 2,500, with 2,464 hospitalizations reported today. As mentioned, we'll be in post-surge when we have fewer than 2,500 hospitalizations for 7 consecutive days. So as long as we don't see an increase, we can expect to launch our post-surge actions next Wednesday. Sadly, we're not yet seeing a sustained decline in deaths. Over the previous 7 days, there were an average of 71 deaths reported each day in LA County, similar to the average number of deaths reported in the prior 7 days. I'm saddened to see so many LA County residents continuing to lose their lives from COVID-19. Each one of the people who we've lost to COVID leaves behind family, friends, colleagues, or other loved ones who are mourning their loss. I send my heartfelt condolences and wishes for strength and peace to each of them. Next slide. This slide is the trend line showing average cases, hospitalizations, and deaths from last July 1st through today, and we do review this every week. Here you can see the steep increases in cases and hospitalizations that occurred at the start of the winter surge, which were followed by a steady and now fairly rapid decline over the past few weeks. Our 7-day averages for cases and hospitalizations have now dropped to around the levels we saw during last winter's surge. Of course, we all aim to drive our metrics down to the levels that were observed before the surges, and we have a distance still to go in order to get there. Although our deaths, thankfully, have not ever reached the levels during this surge that we saw during our last surge, they are significant and they're not dropping yet. Since deaths lag cases and hospitalizations, I'm hoping that we'll soon start to see a sustained decline. Of note, several weeks ago, I mentioned that there was some indication that time to death might be shorter for deaths recorded during the Omicron surge, but that further analysis was needed. Using a longer follow-up period, public health was able to compare time to death during the Delta surge versus the Omicron predominant periods. With the longer follow-up period, median time to death was equivalent across the two surge periods, 11 days in each case. However, these results remain preliminary and no strong conclusions or generalizations should be drawn, since deaths from the most recent period will continue to be reported, and there are a number of other differences between the two periods that could influence the results. Go on to the next slide. We continue to monitor the emerging science around the Omicron BA.2 variant, including findings regarding whether, compared to BA.1, BA.2 may spread more easily from person to person, lead to more severe illness, or be more resistant to treatments or vaccines. As this science develops, preliminary findings may evolve. However, the World Health Organization shared the following key early findings regarding BA.2, which are consistent with the findings that I highlighted at our last briefing. Preliminary data from the UK and Denmark show that BA.2 is about 30% more transmissible than BA.1. In many places, BA.2 is now the most common SARS-CoV-2 lineage that's been detected, although we have not seen substantial spread here in the US or in LA yet. Vaccines appear to be about as effective against BA.2 as other Omicron strains, and it does not appear that there is a risk of reinfection with BA.2 after an earlier Omicron infection. As with any new variant, scientists are still working hard to determine the unique characteristics of BA.2, and more research is needed. We continue to review sequence results for cases that are reported in LA County and to track which variants are present in the county. There are typically delays in sequencing, which affect the totals for the most recent weeks, but this slide does show our latest sequence variants in LA County through January 29th. The red bar represents Omicron, the dominant variant in LA County, and the blue bar represents the Delta variant. The yellow bar, which you barely can see, represents other variants that have been found in LA County. During this time frame, there was only one Delta case identified. 99.9% of the specimens sequenced for this latest reporting period were Omicron, most of which were the BA.1 strain. We've only identified 17 BA.2 subvariant cases in LA County to date, with no new BA.2 cases identified since the last briefing. Next slide. Public Health also regularly publishes COVID-19 data for nearly 350 cities and communities in LA County in our online COVID-19 dashboard and our press releases. So residents, the media, and other stakeholders can always get the latest data for communities of interest. It's also helpful to sometimes map this data so we can more easily see patterns and identify the areas that are most impacted by COVID-19. Today, I'm sharing maps that show the geographic distribution of cases, hospitalizations, and deaths. This first map shows age-adjusted case rates by community for the month of January. The darker colors represent higher case rates, and the lighter colors represent lower rates, with the darkest green color representing the 20% of communities with the highest case rates. When reviewing this, two things are evident. First, COVID-19 has impacted nearly every community in LA County. Second, while COVID-19 has spread across the entire county, some cities and communities experienced higher case rates than others. The cities and communities with the highest case rates, which are shaded in the darkest green, were generally in the areas of central, south, and southeast LA and the San Fernando Valley, with several also in the Santa Clarita Valley, Antelope Valley, and unincorporated areas of LA County. These maps are prepared using information about where people live. Since many people living in areas of high transmission work, go to school, or socialize in areas of lower transmission, it's important to note that the risk of transmission very easily crosses over these neighborhood boundaries. Next slide. This next map shows the age-adjusted cumulative hospitalization rates across LA County. Because there are less hospitalizations than cases, in order to get stable numbers, we had to include hospitalization data from the beginning of the pandemic. Again, areas with higher rates are shaded in darker colors. Areas with lower rates are shaded in lighter colors. Here, although it's over a much longer period of time, we see the same general pattern for hospitalizations as we saw for cases, with significant differences in rates between communities and with similar communities experiencing the highest rates. This again includes parts of Central South and Southeast LA, parts of the San Fernando Valley, and parts of Antelope Valley. Next slide. And this third map shows age-adjusted cumulative death rates by city or community. Again, the darker colors represent higher rates and the lighter colors lower rates. Cases in communities with unstable death rates due to very small numbers of death or small population sizes are shaded in gray. For the areas with the stable rates, the age-adjusted rates range from about 50 deaths per 100,000 residents to over 14,000 deaths per 100,000 residents. Although the areas with the highest death rates weren't identical to those with high hospitalization or case rates, there was substantial overlap. As you can see, many of the cities and communities with the highest death rates are in South LA, Southeast LA, and the San Fernando Valley. Next slide. Together, these slides show that COVID-19 poses a very real risk to everyone across our county, regardless of where they live and work. It's also clear that COVID-19 has disparate impact on certain communities in LA County. From the onset of the pandemic, communities of color, under-resourced communities, and communities with large numbers of essential workers have been most impacted by COVID-19. The differences we observe across these geographic areas are likely affected by a variety of factors, including population density, type of dwelling, and household composition. In addition, employment type and risk of exposure at work contribute to differences. For example, higher rates of COVID-19 in some areas may partially reflect increased transmission among essential workers whose jobs put them in frequent close contact with others. Differences in COVID-19 outcomes are also driven by differences in vaccination rates, access to and use of testing, and access to medical care, as well as an individual's age and the presence of underlying medical conditions. Disparities in COVID-19 outcomes are an important reminder that the conditions that people work and live in can place them at much higher risk during a pandemic. These inequities are a persistent and challenging problem that we all need to continue to pay attention to because they have a profound impact on the residents and communities that they affect, and because they also ultimately impact every one of us. And just as we experienced, every community was affected by the surge. Staffing shortages disrupted work across every sector and threatened our economic recovery efforts. During times of high transmission, the risk of virus mutations also increases, threatening our future progress. Today and moving forward, our strategies need to include measures that protect our workers, whether they're working near their home or across the county. And we need to continue to support those families and communities that have the fewer resources. Next slide. COVID-19 vaccines are highly effective, but their protection does fade over time. Luckily, a booster dose drives protection back up. For example, from January 23rd through the 29th, people in LA County who were fully vaccinated but hadn't had their booster dose were about 6 times less likely to be hospitalized with COVID-19 than those who were unvaccinated. When we add in a booster dose, protection goes way up, with those who were vaccinated and boosted about 19 times less likely to be hospitalized than unvaccinated individuals. Given the importance of vaccines and boosters, we continue to track vaccine uptake. As you can see, we've made good progress with first and second doses for most age groups. but this isn't the case for residents between 5 and 11 years of age, and it's not the case for booster doses. As of February 6th, only a third of residents 5 through 11 have received one or more doses of the COVID-19 vaccine, and only a quarter were fully vaccinated. In addition, only 39% of people ages 12 and over that have been fully vaccinated had received their additional or booster doses. These low rates do create significant vulnerability for the spread of COVID-19 in our county. Next slide. Furthermore, as you can see from this slide, the pace of vaccination is slowing. From January 31st through February 6th, the number of first doses administered during the week was the lowest since COVID-19 vaccines became available in LA County, as we only administered 140,000 first, second, and booster doses combined. By comparison, we administered over 270,000 of those doses near the start of the year between December 27th and January 2nd. While the slower pace does reflect the reality that 8 million LA County residents have been vaccinated, there are approximately 1.8 million eligible residents who haven't yet received their first dose of COVID-19 vaccine, as well as roughly 2.7 million residents who are eligible for but haven't received an additional or booster dose. Lowering transmission and preventing the proliferation of other variants of concern is more likely when more residents are up to date with their vaccines. Next slide. The maps on this slide help us see where we have the biggest gaps in vaccination rates. The first map on my left shows the proportion of LA County residents aged 5 and older who had one or more dose of a COVID-19 vaccine as of February 6th. The second map shows the proportion of residents aged 5 and older who were fully vaccinated and received an additional booster dose as of February 6th. Dark blue and dark purple shading represents these higher vaccination rates, whereas yellow and light green shading on the second map represent the lower rates. On the first map too. The red circles mark areas where there are larger gaps in coverage. When reviewing these, it's evident that we've made significant improvements in coverage with the primary series, although levels vary significantly among communities across the county. For instance, rates are significantly lower in the communities of Compton, Watts, the Crenshaw District, Baldwin Hills, and Inglewood, as well as Acton, Castaic, Palmdale, Lancaster, and various unincorporated areas in northern LA County. Efforts to improve booster coverage are needed across much of the county, with booster coverage particularly low in northern LA County, as well as in the communities of Watts, Florence, Firestone, and Vernon Central. Given the correlation between vaccination coverage and health outcomes, some of the communities with lower vaccination rates are in the same areas where we just saw higher COVID-19 case, hospitalization, and death rates. COVID-19 vaccines, just as a reminder, are available for free at over 1,000 convenient locations, including doctors' offices, clinics, pharmacies, and schools throughout the county. Residents won't be asked about their immigration status. No appointment is needed at so many of the locations, and Uber and Lyft are providing free rides to and from vaccination sites. Residents who are homebound can always request an in-home vaccination. For information and to find a vaccination site, residents can visit vaccinatelacounty.com or vacunatelosangeles.com, or they can call our vaccine call center at 833-540-0473 between 8 a.m. and 8:30 p.m. 7 days a week. Next slide. Safety measures at schools, including routine and response testing programs, are helping to keep our schools safe for students, teachers, and staff. This slide shows school testing volume, represented by the blue bars, and test positivity, represented by the purple trend line over time. For the fourth week in a row, the test positivity rate for schools has declined. Between January 31st and February 4th, over 515,000 tests were administered, with a test positivity rate of 2.6%, which is about an 80% decline since the beginning of January. Next slide. Between January 30th and February 5th, 15 new outbreaks were opened, 7 in elementary schools, 2 in middle schools, 5 in high schools, and 1 in youth sports. Public Health is currently investigating a total of 56 open school outbreaks, and this is up slightly from 52 that were under investigation last week. Given the large numbers of schools and the high volume of students, teachers, and staff who are on school campuses each day, the number of school outbreaks is still relatively low and suggests that schools continue to successfully implement recommended strategies that limit spread, including screening and response testing, ensuring compliance with isolation and quarantine requirements, following the recommended infection control guidelines, and having everyone wearing well-fitting masks that provide maximum filtration as required. Next slide. Pediatric COVID-19 vaccine doses for those 5 to 11 years of age, as well as boosters for eligible students and adults, are offered at no charge at school-based vaccine clinics across the county. These school-based vaccination clinics are a key part of the strategy to help with school safety and increase access to vaccinations at a trusted and a convenient site. Since February of 2021, about 6,000 school-based vaccination clinics have been held in LA County, and we have nearly 1,100 scheduled for February. As you can see on this map, the vast majority of these school clinics are held in communities that are hard hit by the pandemic and often under-resourced. Next slide. And while improving vaccination rates remains a priority, we have relied on other tools as well to help us reduce exposures and transmission. As we think about the post-surge strategies that will be in place shortly, I want to note that we have remained open during this very damaging surge because we used an extensive set of protection measures that help diminish the impact of Omicron. And we're going to need to continue to use some of these strategies post-surge. It's also important to recognize that our post-surge plan is a living plan. It reflects where we are today in the pandemic and our best knowledge of where we expect to be post-surge. If conditions change, we'll reassess, and if needed, modify our mitigation strategies. A variety of factors could necessitate changes to our approach, but there are 2 that I am certain would require us to modify our plans and strategies. First, we'll redefine our plan if we have a new tool that improves outcomes, such as an adequate supply of the highly effective therapeutics. Currently, newer therapeutics, such as the oral medication Paxlovid, are in scarce supply. If we could ensure adequate access to these therapeutics, this would mitigate the worst effects of COVID, and we would refine our strategies. On the other hand, if a new variant emerged, which was more infectious, evaded a lot of the vaccine protection, and/or caused more serious illness, we would need to consider layering in more protections again. So as we move into and through the post-surge period, we'll do what we've done throughout the pandemic. Monitor the situation and adapt our plans to ensure that we can all do our best to protect each other and our communities. We know that some residents and stakeholders are hoping for an end to the masking requirements, especially given recent changes to the state's masking rules. Public Health understands and shares this desire to take masks off, and some changes will be occurring soon. However, the issue here in LA County is one of timing. Masks provide an essential layer of protection when transmission is high, and the vaccine protections have waned. They help us reduce exposures and drive down our case numbers. Despite recent declines, transmission in LA County remains high. In fact, cases and hospitalizations this past week were higher than when the governor issued the statewide masking mandate on December 15th, which was intended to help slow transmission. When the governor issued this mask mandate, LA County reported 1,600 new cases and 772 hospitalizations. Across the state, there were about 5,500 cases reported and 3,600 people hospitalized. By comparison, today in LA County alone, we're reporting almost 6,300 new cases and just about 2,500 people are hospitalized with COVID-19. We do have to consider that our case numbers are about 4 times higher than they were on December 15th when the state's mask mandate was issued. and that transmission does remain really high. And while it's always important to consider personal risks and benefits, public health is also charged with assessing risks and benefits across populations. The costs of high transmission are not just borne by individuals, and they're not distributed equally. High transmission leads to severe disruptions associated with staffing shortages, reduced economic security for many when quarantining or isolating without sick pay, and higher morbidity and mortality for those most vulnerable and with more exposures. The burden of COVID-19 remains high. In the month of January, there were over 841,000 new cases of COVID in LA County, including 265,000 cases among children, just for 1 month. In December, 396 individuals died from COVID, compared to 163 individuals from pneumonia, flu, and respiratory ailments. There are unknowns still around the burden of long COVID and MIS-C in terms of ongoing disabilities, particularly those associated with the Omicron variant. And we don't yet have adequate supplies of the therapeutics that would be available to treat everyone who's a good candidate. Being cautious still makes sense, and doing everything we can to drive down the high rates of transmission remains an appropriate goal for us to continue to embrace as a community. Nonetheless, because transmission has declined significantly, it is also time to consider sensible changes to our mitigation efforts. As we noted earlier, with COVID hospitalizations dropping below 2,500 today, we anticipate being able to lift the outdoor masking requirements at outdoor mega events and childcare and schools later next week, hopefully by Wednesday. As mentioned earlier this week, in alignment with CDC recommendations, post-surge, masking will continue to be required for indoor establishments, including indoor offices and work sites, indoor events, and indoor high-risk settings, until the following conditions are met. LA County has 2 consecutive weeks at or below moderate transmission, which, as defined by the CDC, is fewer than 50 new cases per 100,000 persons for a weekly rate. That translates into about 730 cases a day. Or vaccines have been available for children under 5 for 8 weeks. And of course, that there are no emerging reports of significantly circulating new variants of concern that threaten vaccine effectiveness. Where there are federal and state regulations, masking will also continue to be required. This includes when riding public transit and in transportation hubs as required by federal regulations, and indoor masking requirements as required by state regulations at TK through grade 12 schools, childcare, youth settings, healthcare settings, correctional facilities, homeless and emergency shelters, and cooling centers. Local jurisdictions cannot be less restrictive than the state or the federal government. So it's important to note that the school indoor masking requirement remains in effect per the state order. Sites will also need to continue to adhere to any applicable masking requirements that are included in other state or LA County health officer orders or the all facilities letters that are for healthcare facilities. We'll be asking that employers continue to provide workers with high quality and well-fitting masks if their jobs put them in close contact with other workers or the public. Until transmission is much lower, we'll also continue to recommend that we do keep our masks on whenever we're in close contact with others in indoor or in outdoor crowded spaces. We know that throughout the pandemic, businesses and organizations have voluntarily put in extra precautions to protect their workers, customers, or the public. They'll continue to have the discretion to require masking of workers, customers, and the public. And as we've shared many times, masking is one of the easier steps we can all take to reduce the spread of COVID-19. And we do thank residents for continuing to take this simple action to protect themselves, protect workers, protect those who cannot get vaccinated, and protect those at high risk of severe illness. I know some are worried that we have set an aspirational goal for rescinding indoor masking requirements. The truth is that for 4 months last year, from March 18th through July 10th, we were in the moderate transmission category every single day. And I think it's possible to get to moderate transmission again fairly quickly. Our case rate is dropping an average of 3.5% every day. And if we can maintain that pace, we'd reach moderate transmission in 25 to 30 days. Of course, we do need to continue the common sense measures that slow COVID-19 transmission until we reach this more acceptable level of risk for the county. These measures, as always, include getting vaccinated and boosted, wearing well-fitting masks or respirators when recommended, following the COVID-19 prevention guidelines at our schools and work sites, staying home if you're sick or exposed to COVID-19, and following public health's guidance for gatherings. Next slide. I do also want to note that vaccination verification requirements will continue at mega events, both indoor and outdoor events, and to enter the indoor portions of bars, lounges, nightclubs, wineries, breweries, and distilleries until transmission is much lower. Next slide. In closing, I want to note that all across the county, many have spent time this past week celebrating the extraordinary accomplishments of the Rams, and that we're only 3 days away from the Super Bowl. We welcome NFL fans to beautiful LA, and we're excited about the opportunity this year to host the Super Bowl while we're fully open. We do ask that everyone take care to minimize risks during the pandemic. Whether attending the game at SoFi Stadium, a pregame event, or gathering at someone's home, many of us will be spending several hours eating, drinking, cheering, and shouting with people from very different households. Because these are all conditions that can make it easy to spread COVID-19, we're asking fans to follow some common sense recommendations that can reduce the chance that they expose themselves or others to COVID-19. It still makes sense to get vaccinated or boosted before the game. Consider getting a rapid COVID-19 test as close to the start of the game as possible as an added precaution, especially if you're gathering indoors or with people who are unvaccinated or at higher risk for severe illness. If after the game you think you've been exposed to someone with COVID-19, consider getting tested again. If you're sick or you have a positive COVID-19 test, please don't attend the game, an event, or any gatherings. You should stay home away from others, and hopefully you'll be able to join a gathering virtually. If you're hosting a gathering, smaller is better than large. We ask that you try to gather outdoors if possible, since outdoors is always safer than indoors, especially when masks are going to be off for eating and drinking. When that's not possible, do what you can to improve the airflow inside. If it's safe, open windows and doors, use fans and portable air cleaners, and run your air conditioner and continue to ventilate the space after your guests have left. Wash your hands before and after preparing food, have hand sanitizer available, and opt for individual or household snack bowls. Unless everyone's up to date with their vaccines, keep a distance when eating, especially if you're indoors. If you're going to the game or to a bar or a restaurant to watch the game, please be safe and follow the venue's masking requirements. And in some places in LA County, there are vaccination verification requirements as well. If you're indoors, you should wear a more protective mask. And if you're at high risk for COVID-19 infection or severe illness, think about wearing that well-fitting respirator. An N95, KN95, KF94s will work better than less protective masks. If you're at a crowded outdoor gathering with unvaccinated people or people whose vaccine status you don't know, it does make sense to wear a mask outdoors as well. And please don't drive impaired to and from any activities. For those attending events at SoFi Stadium or at the Super Bowl experience at the Convention Center, please note that you're going to need to wear a mask and verify your vaccination status or provide a negative test result prior to entering these events. We're grateful to the NFL and to SoFi Stadium for all their efforts to make it easy for everyone to be as safe as possible. Thanks to the NFL, rapid testing and masks are available at both sites. If you get vaccinated at the clinic being held at the Super Bowl experience, you'll receive a free entry to the event. And everyone attending will be given a home test kit to use on Sunday before gathering to watch the big game. In closing, I'm grateful to everyone for all you're doing to take care of each other. I know this is a particularly hard time, and many of us would like to lift the safety precautions more quickly. As has been the case throughout the pandemic, we appreciate the different experiences and perspectives of all residents, and we do our best to listen to the concerns, and then we use the science to guide a path forward that remains focused on protecting those most vulnerable, our essential workers, and our healthcare system. Given where we are and the continued risk associated with these high rates of transmission, we'll need to continue to use sensible safety precautions. Thank you, and I'm happy to take your questions.
Thank you so much, Dr. Freer. We will move on to the question portion. As a reminder, if you have a question, please use the hand icon or you may chat me, the host. Our first question comes from Christopher Weber from the Associated Press. You're unmuted.
Hey, thanks. Hi, Dr. Freer. What is the metric for lifting the vaccine mandate? You said transmission needs to be much lower. How much lower? Can you share what the numbers are for that?
Thanks so much. And again, we only have vaccination verifications required by the county in two sectors, you know, the bars, the lounges, nightclubs, and at mega events. At mega events, it's also a requirement by the state. We know we're not lifting it anytime soon. We want our transmission rates to be lower. We might mark this along with moderate transmission, or we may, depending on what other data we're looking at, we may want to go lower. But for now, we're asking everyone to really continue with those vaccination verifications. For us, those are the two highest risk sites, mostly because lots of people are without their masks for extended periods of time, moving about in crowded situations.
Thank you so much. Our next question comes from Ron Lynn from the LA Times. Ron, go ahead.
Hi, Dr. Ferrer. Thanks so much for taking our questions. We really appreciate it. Our questions today are on the timing of lifting the indoor mask mandate, a question on BA2, and a medical question on COVID resulting in higher risk of subsequent heart disease. So first, thanks for your calculations. You mentioned that we'll meet the goalpost for case rates in terms of lifting the indoor mask mandate in about a month, which would be in early March. Does that mean we would be on pace to lift the local indoor mask mandate 2 weeks later and by late March? Second, you've mentioned that one of the things that could halt our progress to lifting the indoor mask mandate would be emerging reports of significantly circulating new variants of concern that threaten vaccine effectiveness. Would a surge of BA2 potentially slow our path, or do you not consider BA2 as threatening vaccine effectiveness? And finally, there was a study that emerged this week looking at millions of US veterans records that found that risk of heart disease, including heart attacks, was substantially worse in veterans who survived COVID compared to those who didn't. Does information like this underscore that COVID can cause more long-lasting effects than the flu? And are findings like these more reason to still try to avoid getting infected? And then just lastly, just a small question on the 11 days, the time to death. Does the beginning point that you were referring to, like the date of diagnosis or the date of the positive test? Thanks.
Yeah, thanks. Let me just start with the last one because it's easy. Yeah, it depends on you know what we've got to mark that case. So many times it is the positive test. Sometimes it's onset of symptoms, but it is at the point that there's a recognition that a person is positive. And in terms of you know, let's take it from the top. The sort of, you know, are we hopeful about lifting? Was the calculation that you presented accurate? Yeah, that is the calculation. You know, if we maintain this steady pace of decline, we get there in 25 to 30 days. And then you're right, we need to stay at a lower level for 2 consecutive weeks. And then we would go ahead and make that change. So if everything goes well, yeah, you know, at some time, you know, by the end of March, we should be able to more safely lift the requirements on indoor masking, obviously knowing that for many people, keeping those masks on is still going to make a lot of sense. In terms of, you know, what's the threat that we would look at, I want to note that with Omicron for us, Omicron, our vaccines still work remarkably well against Omicron. I mean, it's hard because we have some vaccine waning for people who haven't gotten their booster, and it obviously works less well for preventing infections than the vaccines were working initially against the ancestral strains, but they still work remarkably well, even on preventing infections, and certainly for preventing hospitalizations and deaths, those most serious outcomes. And we, at this point, have no indication that BA.2 is acting different. So I don't think circulation of BA.2 would be, from our minds now, given the information we have today, a reason for a delay in lifting the masking, the masking protection. I think we're really thinking about a new variant of concern that comes through and really is evading a lot of the vaccine protections. And that would be super worrisome. And, when the vaccines don't work so good, using the mask is sort of our second layer of defense. So we'd want to keep that in place should that develop. And our hope is that as more people get vaccinated and boosted, as more people are cautious about trying to, get us out of these explosive numbers of new cases, there's less possibility for there to be a lot more mutations. So it all hangs together here. Lowering transmission also helps us lower the possibility that we get these dangerous variants of concern. So I think, you're hearing from us, there's a number of reasons right now why it makes sense to keep the masks on, because we're really still about trying to get transmission to a lower level. And it gets to your last question about coronary heart disease seeing an increase in coronary heart disease for folks weeks and months after recovering from COVID. And it's why, we have said from the beginning, let's be really cautious about not assigning to Omicron this label that it causes mild disease, because we have been really struck by the large numbers of people who have been infected with previous strains of COVID that have had what gets classified as long COVID, either symptoms that continue for way longer than anybody would anticipate, but more likely folks recover and then a few months later they're really sick again. And for some people, they have very mild illness, and then 3 months later they have some really pretty debilitating health issue related to the virus's infection. So I don't think we should be discounting the fact that COVID remains a virus that can cause very serious disease, and we just don't know enough yet. We also have no way of knowing yet how Omicron relates to what we're going to see in MISC in children, because we usually don't see that for 8-10 weeks out from children getting infected. So I think caution is still the appropriate strategy for all of us, given how extraordinarily high our rates of transmission still are. Thanks for that.
Thank you so much. Our next question is going to come from Marla Tellez from Fox 11. Marla, go ahead.
Good afternoon, Dr. Ferrer. Thank you so much for taking my questions. I have a few. My first one is Governor Newsom yesterday out at an event in Oakland. He alluded to making some changes, an announcement, he said maybe as early as Monday, about masks and students K through 12. So if in fact the governor outlines his plan to lift the indoor mask mandate for students K through 12 in the state of California, do you anticipate aligning with the state plan? In other words, will you in fact lift the indoor mask mandate as outlined by the governor? Question one. Question two, as we head to Super Bowl Sunday, I know it's a huge deal for our area, lots of excitement. As it comes, though, about masks, what happened at the NFC Championship game and the lack of masks in the stand and the talk of lack of enforcement. Why even have the indoor mask or the outdoor mask mandate if it's not going to be enforced? What is your overall feeling going into Sunday? I mean, does that give you pause? Does that make you concerned, given still the high transmission? And then lastly, as it relates to kids and masks, getting back to that topic, and it's really warm. I mean, it's going to be the warmest Super Bowl on record. It could be. Kids, is it a good idea for kids to be wearing their masks outdoors right now in this sort of weather, given how warm it is in February? That's it. Thank you.
Yeah, thanks so much, Marla, for the thoughtful questions. Let me just start from the top. Yeah, we have heard also, I mean, we haven't gotten any official notification, but we have heard from the comments he made a couple of days ago that he's planning an announcement next week about the path that the state is going to suggest to take in terms of plans around mitigation efforts at schools K to 12. I'm not sure that it's just going to be around masking. There may, the state has put out a lot of guidance for schools around quarantining and isolating as well, and around testing. So we're looking forward to seeing what that plan looks like and assessing it. I want to note in general, we try to align as much as possible with the state, and certainly the intention would be to do the same. When we don't align, it's because after reviewing a state plan, which, as you know, needs to take into account lots of other counties and conditions all across the state, not just in LA. So sometimes the state is moving in a direction that doesn't really make sense for our county or some other county. And I want to note the governor has been really clear that there is local responsibility and folks need to look at the local situation and make their assessment. For example, if you look on the CDC tracker today, you will find that the range of case rates in California goes as high as almost 1,800 new cases per 100,000 residents in Monterey County to 300 new cases per 100,000 residents in Marin County. These are weekly rates. LA County is kind of in the middle at 622 new cases per 100,000. But that's a huge range, and obviously there are going to be times where it's going to be important, depending on what's going on in LA County, for us to move in a slightly different direction. But we always appreciate the guidance from the state. We take a look at it. We consult always with our school partners and with LACO, and then try to move in a direction, and our labor partners, and try to move in a direction that makes sense for LA County. And we will do the same around plans for new policies around schools, understanding full well that we have to, again, as case rates drop, be able to look at data and make decisions informed by that data. But we have to look at LA County data. I hear the question and I appreciate it about Super Bowl Sunday. I wanna put some context around what happens at the large arenas that's different than what happens at schools, places of business, restaurants, outside of LA City. To get into the stadium, everyone has to either be vaccinated or have a negative test result within a couple of days of being there. 1 day if it's antigen, 2 days if it's a PCR test. There's a very different layer of protection that everybody has when they're walking in the door. And that's on purpose because it's very crowded. It's also on purpose in acknowledgement of the fact that we do allow people to take their masks off when they're eating and drinking. And sometimes at these events, people are eating and drinking for a longer period of time than they might be if they were just sitting down for a meal. And we know that. We know that people can be eating a whole bunch of popcorn, a lot of fries, a lot of candy. You could be drinking a beverage and taking some time to drink that beverage. And we acknowledge that everyone in the stands, when they're at their seats, is not going to be keeping their mask on the entire time. We do ask people to put it back on if you're not actively eating or drinking, but we also recognize that people can get forgetful or they get excited and they forget to put it on. I want to applaud all of the event venues who are trying, every week, trying new strategies to remind people gently and respectfully to put those masks back on so that we can continue to protect each other. And I think we have never, we have never, ever given any single person a citation because they weren't wearing their mask. So I just want to, I'm not sure what enforcement people would like to see, but we don't enforce the masking mandate by giving citations to individual people. We ask businesses and entities to work really hard, and we work hard in partnership with those entities to try to figure out ways that people will in fact go ahead and wear those masks as appropriate when they're not eating or drinking in the case of the venues. So, I appreciate the attention. I appreciate the concerns. I also appreciate that it's a different setting. And because it's a different setting, it's been a challenge to actually see what everybody would like to see, which is sort of the uniform picture of every single person having their mask on when the cameras pan them. But I don't think that's likely or possible, given that people are allowed to take them off when they're eating or drinking. On the other hand, my message to everyone is there is a lot of transmission still. No need to come back from that Super Bowl game that you so enjoyed and then get sick with COVID. So you can prevent a lot of that with common sense precautions, including keeping that mask on when you're not actively eating or drinking. And I hear you on sort of masking when the temperatures are high. We've had masking requirements before when temperatures are high. We ask people to stay hydrated and make sure that everybody is drinking a lot. We always suggest that parents monitor very carefully their children, especially younger children who are wearing masks, to make sure that they are in fact staying hydrated. And again, as I've noted, when you're drinking or eating at the stadium, you are allowed to take off that mask. And we anticipate that since it will be hot, a lot of people will need to be drinking a lot during the afternoon. So hopefully I got to your questions, Marla.
Our final question for today is from Howard Bloom from the Los Angeles Times. Howard, go ahead.
Hi, thanks for squeezing me in here. I realize that there is a state order that applies to school, and you have addressed this partly already, but I'm just wondering if you were doing the analysis, what will or should be the threshold for ending the indoor mask mandate at schools?
Yeah, thanks so much. It's a very important question to consider because it again is a very unique setting. That's why I was noting I would really want an opportunity to review the state's guidance, because I think the opportunity at schools, it's a very structured environment. So the opportunity at schools to layer in other protections that may help mitigate transmission is pretty significant. And I'd want to see what the state was considering as they think about lifting the indoor mask mandate. So in the long run, I'd want an opportunity to review the state's recommendations. I do want to say transmission is still too high to lift indoor masking in any setting at the moment. I mean, we have some of the highest case numbers we've ever seen. If it wasn't for the fact that we're coming out of the Omicron surge, where the rates were extraordinarily high, we would all be deeply troubled by my numbers today, which were about 6,300 new cases. We'd be troubled as well by the number of people who continue to die. I think we care deeply here in LA County about morbidity and mortality. I don't think we're ready to just sort of say, people just die and that's just how it is. I think we're going to do our very best to continue to work hard to prevent as much transmission as we can until these rates get lower, where transmission just isn't going to be as likely, where people are spending a lot of time together indoors. Thank you. And thanks for that. Of course, go Rams, and we'll talk to you next week.
Thank you so much, Dr. Freer. Thank you to everyone who joined us today. As a reminder, if you have media questions for us, you can send them to our media inbox, and that is media@ph.lacounty.gov. Please stick around if you're waiting for our Spanish presentation. It'll be in just a few minutes. Good afternoon, Monica. How are you doing?
Good, Kim. I'm doing good.
Excellent. Let me get your slides pulled up and we will get going. All right, if you'd like to go ahead and I'll go ahead and get started here.
Okay.
Good afternoon, everyone. Thank you so much for joining us for the Spanish portion of today's briefing. Today is Thursday, February 10th. We have Monica presenting. Monica, when you are ready.
Thank you so much, Kim. Muy buenas tardes y gracias por acompañarnos. Agradecemos la oportunidad de compartir una vez más nuestra última actualización sobre la pandemia de COVID-19 y también absorber algunas de sus dudas. En la sesión informativa de hoy compartiremos nuestros números actuales sobre casos, hospitalizaciones, muertes y variantes. Daremos a conocer varios mapas que muestran dónde estamos viendo las tasas más altas de casos, hospitalizaciones y muertes por COVID. Luego presentaremos nuestros últimos datos de cobertura de vacunación y proporcionaremos algunas actualizaciones sobre la pandemia en las escuelas. Revisaremos nuestra planificación posterior a la pandemia o a este pico de la pandemia del que hablamos la semana pasada. Y finalmente cerraremos con algunos recordatorios sobre cómo este domingo todos nuestros fanáticos del fútbol americano pueden disfrutar del supertazón de manera segura. First slide, please. Durante las últimas semanas hemos estado informando noticias alentadoras que en nuestros casos, la tasa de positivos con base en las pruebas y las hospitalizaciones estaban comenzando a disminuir. Nos complace compartir que esta semana las tendencias a la baja continúan. A medida que mejoran nuestros números, estamos desarrollando un plan para manejar la etapa posterior al pico de la pandemia que guiará cómo continuaremos mitigando el riesgo de COVID en el condado de Los Ángeles una vez superemos la oleada invernal. Esto realineará nuestra respuesta, estrategias y requisitos actuales de salud pública para satisfacer las necesidades de mitigación. Dado que nuestros números reflejan cómo nos está yendo con el control de la propagación de COVID-19, la prevención de enfermedades graves y muertes y la cobertura de atención médica, serán clave para nuestro enfoque de manejo de la fase posterior a la oleada. Por ejemplo, consideraremos que el condado de Los Ángeles está fuera del pico cuando tengamos menos de 2.500 hospitalizaciones durante 7 días consecutivos. Además, basaremos algunas de nuestras modificaciones posteriores a la oleada, como los cambios en los requisitos de verificación de vacunas y uso de mascarillas, en nuestro nivel de contagio comunitario con base en las definiciones de los CDC. Cabe enfatizar que etapa posterior a la oleada no significa que la pandemia haya terminado, que el contagio sea bajo o que no habrá oleadas adicionales impredecibles en el futuro que requerirán medidas integrales de salud pública. Más bien, reconoce que nos estamos estabilizando con disminuciones constantes desde el pico máximo y realinea nuestra respuesta actual de salud pública para satisfacer las presentes necesidades de mitigación. Con esto en mente, revisaremos nuestros números habituales, comenzando con los casos de COVID. Hace varias semanas alcanzamos nuestro máximo número de pandemia de 46,000 casos nuevos informados en un solo día. Hoy estamos reportando 6,276 casos nuevos. La cantidad promedio de casos nuevos diarios informados durante los últimos 7 días se redujo a cerca de 7,500 de aproximadamente 15,600 en los 7 días anteriores. Y desde el jueves pasado, nuestra tasa promedio de casos diarios ha bajado a 74 casos nuevos por 100,000 residentes de 154. Nuestra tasa de casos positivos con base en la prueba diaria, que es el porcentaje de todas las pruebas de COVID-19 realizadas que resultan positivo, también ha seguido cayendo. Hoy nuestro promedio de 7 días ha bajado a 4,7% desde alrededor del 6% de hace una semana. Si bien estas disminuciones son signos importantes de que la transmisión comunitaria continúa disminuyendo, los números y las tasas en sí mismos indican que el condado de Los Ángeles todavía se encuentra en una fase de alto contagio comunitario, según lo definido por los criterios de los CDC. Y debemos mantenernos enfocados en las estrategias que reducen la propagación. La cantidad de personas que necesitan ser hospitalizadas debido a COVID también ha seguido disminuyendo. Durante los últimos 7 días hubo un promedio de cerca de 2.800 hospitalizaciones diarias en comparación con las 3.800 de los 7 días anteriores. Y por primera vez en varias semanas, nuestras hospitalizaciones diarias cayeron por debajo de 2.500, con 2.464 hospitalizaciones informadas hoy. Como se mencionó, estaremos en la etapa posterior a la oleada cuando tengamos menos de 2.500 hospitalizaciones durante 7 días consecutivos. Por lo tanto, mientras no veamos un aumento, podemos esperar presentar nuestras acciones posteriores a la oleada el próximo miércoles. Lamentablemente, todavía no estamos viendo una disminución sostenida de las muertes. Durante los 7 días anteriores hubo un promedio de 71 muertes reportadas cada día en el condado de Los Ángeles, similar al número promedio de muertes de los 7 días anteriores. Nos entristece ver tantos residentes del condado de Los Ángeles que continúan muriendo por COVID-19. Cada una de las personas que hemos perdido por el COVID deja atrás familiares, amigos, colegas u otros seres queridos que están de luto por su pérdida. Enviamos nuestro más sentido pésame y deseos de fortaleza y paz para cada uno de ellos. Next slide, please. Esta diapositiva es la línea de tendencia que muestra el promedio de casos, hospitalizaciones y muertes desde el 1 de julio pasado hasta hoy que revisamos cada semana. Aquí puede ver los fuertes aumentos de casos y hospitalizaciones que ocurrieron durante la oleada del invierno, a los que siguió una disminución constante y bastante rápida en las últimas semanas. Nuestros promedios de 7 días para casos y hospitalizaciones ahora se han reducido a los niveles que vimos durante el aumento del invierno pasado. Por supuesto, nuestro objetivo es reducir nuestras medidas o nuestras cifras a los niveles que se observaron antes de los aumentos repentinos, y todavía tenemos un camino por recorrer para llegar allí. Aunque nuestras muertes afortunadamente no han alcanzado los niveles que vimos durante nuestra última oleada, son significativas y aún no están disminuyendo. Dado que las muertes van a la saga de los casos y las hospitalizaciones, esperamos que pronto comencemos a ver una disminución sostenida. Cabe señalar que hace varias semanas mencionamos que había algunos indicios de que el lapso que pasa hasta la muerte podría ser más corto para los decesos registrados durante la oleada de Omicron, pero se necesitaban más análisis. Al usar un periodo de seguimiento más largo, Salud Pública comparó el periodo hasta la muerte cuando Delta y Omicron predominaban. Con un periodo de seguimiento más prolongado, la mediana del tiempo hasta la muerte fue equivalente en los dos periodos, 11 días en cada caso. Sin embargo, estos resultados siguen siendo preliminares y no se deben sacar conclusiones ni generalizaciones sólidas, ya que se seguirán informando en las muertes del periodo más reciente y existen otras diferencias entre los dos periodos que podrían influir en los resultados. Next slide, please. Continuamos monitoreando la ciencia que ha surgido con respecto a la variante Omicron BA.2, incluidos los hallazgos sobre si, en comparación con BA.1, la BA.2 puede propagarse más fácilmente de persona a persona, provocar enfermedades más graves o ser más resistente a tratamientos o vacunas. A medida que esta ciencia se desarrolla, los descubrimientos preliminares pueden evolucionar. Sin embargo, la Organización Mundial de la Salud compartió los siguientes hallazgos iniciales con respecto a BA.2, que son consistentes con los que destacamos en nuestro último informe. En algunos países, BA.2 se está volviendo dominante y parece tener el potencial de reemplazar a BA.1 como la subvariante dominante. En los Estados Unidos, BA.2 sigue siendo una pequeña proporción de todos los especímenes secuenciados y no parece estar creciendo al ritmo que se observa en otros lugares. Los datos preliminares del Reino Unido y Dinamarca muestran que BA.2 es cerca de un 30% más contagiosa que BA.1. En muchos lugares, BA.2 es ahora el linaje de SARS-CoV-2 más común detectado, aunque todavía no hemos visto una propagación sustancial aquí en los Estados Unidos. Las vacunas parecen ser tan efectivas contra BA.2 como contra otras cepas de Omicron y no parece que exista riesgo de reinfección con BA.2 después de un contagio anterior con Omicron. Al igual que con cualquier variante nueva, los científicos todavía están trabajando arduamente para determinar las características únicas de BA.2 y se necesita más investigación. Continuamos revisando los resultados secuenciados de los casos que se informan en el condado de Los Ángeles y rastreando qué variantes están presentes en el condado. Por lo general, hay retrasos en la secuenciación que afectan los totales de las semanas más recientes y esta diapositiva muestra nuestras últimas variantes secuenciadas en el condado de Los Ángeles hasta el 29 de enero de 2022. La barra roja representa Omicron, la variante dominante en el condado de Los Ángeles, y la barra azul representa la variante Delta. La barra amarilla, que apenas se ve, representa otras variantes que se han encontrado en el condado de Los Ángeles. Durante este periodo, solo se identificó un caso de Delta. El 99.9 de los especímenes secuenciados para el último periodo del informe fueron Omicron, la mayoría de los cuales fueron de la cepa BA.1. Hasta la fecha, solo hemos identificado 17 casos de las subvariantes BA.2 en el condado de Los Ángeles, sin nuevos casos de BA.2 identificados desde la última sesión informativa. Next slide, please. Salud Pública regularmente saca datos sobre COVID para casi 350 ciudades y comunidades del condado en nuestro panel de control de COVID-19 en línea y a través de nuestros comunicados de prensa, los residentes, los medios y las partes interesadas siempre pueden obtener las cifras más recientes para las comunidades de interés. También es útil mapear estos datos, ya que podemos ver más fácilmente los patrones e identificar las áreas más afectadas por COVID-19. Hoy compartimos mapas que muestran la distribución geográfica de casos, hospitalizaciones y muertes. Este primer mapa muestra las tasas de casos ajustadas por edad por comunidad para el mes de enero. Los colores más oscuros representan tasas de casos más altas y los colores más claros representan tasas más bajas y el color verde más oscuro representa el 20% de las comunidades con las tasas de casos más altas. Al revisar esto, dos cosas son evidentes. Primero, COVID-19 ha afectado a casi todas las comunidades del condado de Los Ángeles. Segundo, si bien el COVID-19 se ha extendido por todo el condado, algunas ciudades y comunidades experimentaron tasas de casos más altas que otras. Las ciudades y comunidades con las tasas de casos más altas, que están sombreadas en el verde más oscuro, fueron las áreas del centro, sur y sureste de Los Ángeles y el Valle de San Fernando, con varias también en el Valle de Santa Clarita, el Valle de Antílope y áreas no incorporadas del Condado de Los Ángeles. Estos mapas se preparan utilizando información sobre dónde vive la gente. Dado que muchas personas que residen en áreas de alto contagio trabajan, van a la escuela o socializan en áreas de baja propagación, es importante tener en cuenta que el riesgo de transmisión cruza muy fácilmente los límites entre vecindarios. Next slide, please. El siguiente mapa muestra las tasas de hospitalización acumuladas ajustadas por edad en todo el condado de Los Ángeles, debido a que hay menos hospitalizaciones que casos. Para obtener números estables, incluimos datos de hospitalizaciones desde el comienzo de la pandemia. Nuevamente, las áreas con tasas más altas están sombreadas en colores más oscuros. Las áreas con tasas más bajas están sombreadas en colores más claros. Aquí, aunque durante el periodo mucho más largo, vemos el mismo patrón general de hospitalizaciones observado en los casos, con diferencias significativas en las tasas entre comunidades y colectividades similares que experimentan las tasas más altas. Esto incluye el centro, sur y sureste de Los Ángeles, partes del Valle de San Fernando y partes del Valle de Antílope. Next slide, please. En este tercer mapa muestra las tasas de mortalidad acumuladas ajustadas por edad, por ciudad o comunidad. Nuevamente, los colores más oscuros representan tasas más altas y los colores más claros tasas más bajas. Las ciudades y comunidades con tasas de mortalidad inestables debido a la pequeña cantidad de muertes o al pequeño tamaño de la población están sombreadas en gris. Para áreas con índices estables, los índices ajustados por edad oscilaron entre aproximadamente 50 muertes por cada 100,000 residentes y más de 14,000 muertes por cada 100,000 residentes. Aunque las áreas con las tasas de mortalidad más altas no eran idénticas a aquellas con las tasas de hospitalización o casos, hubo una superposición sustancial. Y como puede ver, muchas de las ciudades o comunidades con las tasas de mortalidad más altas se encuentran en el sur de Los Ángeles, el sureste de Los Ángeles y el Valle de San Fernando. Next slide, please. Estas dos diapositivas muestran que COVID-19 representa un riesgo muy real para todos en nuestro condado, independiente de donde vivan o trabajen. También está claro que COVID-19 tiene un impacto desigual en ciertas comunidades del condado de Los Ángeles. Desde el inicio de la pandemia, las comunidades de color, las comunidades de escasos recursos y las que cuentan con una gran cantidad de trabajadores esenciales han sido las más afectadas por COVID-19. Las diferencias que observamos entre áreas geográficas probablemente se vean afectadas por una variedad de factores que incluyen densidad de la población, tipo de vivienda y composición del hogar. Además, el tipo de empleo y el riesgo de exposición en el trabajo contribuyen a las diferencias. Por ejemplo, las tasas más altas de COVID-19 en algunas áreas pueden reflejar parcialmente un mayor contagio entre los trabajadores esenciales cuyos trabajos los ponen en contacto cercano frecuente con otros. Las diferencias en los resultados de COVID también se deben a las brechas en las tasas de vacunación, el acceso y el uso de pruebas y el acceso a la atención médica, así como la edad y la prevalencia de las afecciones médicas subyacentes. Las disparidades en los resultados de COVID son un recordatorio importante de que las condiciones en las que las personas trabajan y viven pueden ponerlas en un riesgo mucho mayor durante esta pandemia. Estas desigualdades son un problema persistente y desafiante al que todos debemos prestar atención porque tienen un profundo impacto en los residentes y las comunidades a las que afectan y porque, en última instancia, también nos afectan a todos. Como acabamos de experimentar, todas las comunidades se vieron afectadas por el aumento. La escasez de personal interrumpió el trabajo en todos los sectores y amenazó nuestros esfuerzos de recuperación económica. En tiempos de alto contagio también aumenta el riesgo de mutaciones del virus, lo que amenaza nuestro progreso futuro. Hoy Hoy y en adelante, nuestras estrategias deben incluir medidas para proteger a los trabajadores, ya sea que laboren cerca de su casa o estén en todo el condado y que apoyen a las familias y comunidades que tienen menos recursos. Next slide, please. Las vacunas contra el COVID son altamente efectivas, pero su protección se desvanece con el tiempo. Por fortuna, una dosis de refuerzo aumenta la protección. Por ejemplo, del 23 al 29 de enero, las personas en el condado de Los Ángeles que estaban completamente vacunadas, pero que no habían recibido sus dosis de refuerzo, tenían aproximadamente 6 veces menos probabilidades de ser hospitalizadas con COVID que las personas no vacunadas. Cuando agregamos una dosis de refuerzo, la protección aumenta considerablemente y aquellos que fueron vacunados y recibieron el refuerzo tienen aproximadamente 19 veces menos probabilidades de ser hospitalizados que las personas no vacunadas. Dada la importancia de la vacuna y los refuerzos, seguimos haciendo un seguimiento a la aceptación de las vacunas. Como puede ver, hemos avanzado mucho con la primera y la segunda dosis en la mayoría de los grupos de edad, pero este no es el caso para los residentes de 5 y 11 años o a 11 años y para los residentes y para las dosis de refuerzo. Al 6 de febrero de 2022, solo un tercio de los residentes de 5 a 11 años habían recibido una o más dosis de la vacuna COVID-19 y solo una cuarta parte de ellos estaban completamente vacunados. Además, solo el 39% de las personas de 12 años y más se habían vacunado por completo y habían recibido una dosis adicional o de refuerzo. Estas bajas tasas crean un ambiente propicio para la propagación significativa de COVID-19 en nuestro condado. Next slide, please. Además, como puede ver en esta diapositiva, nuestro ritmo de vacunación se está desacelerando. Desde el 31 de enero hasta el 6 de febrero, la cantidad de primeras dosis administradas durante la semana fue la más baja desde que las vacunas COVID estuvieron disponibles en el condado de Los Ángeles, ya que solo administramos 140,000 dosis de la primera, la segunda y el refuerzo combinados. En comparación, administramos más de 270,000 de esas dosis entre el 27 de diciembre y el 2 de enero pasados. Y si bien el ritmo más lento refleja la realidad de que 8 millones de residentes del condado de Los Ángeles han sido vacunados, hay cerca de 1,8 millones de residentes que han sido aprobados que aún no han recibido su primera dosis de la vacuna, así como alrededor de 2,7 millones de residentes que han sido aprobados, pero no han recibido una dosis adicional o de refuerzo. Es probable reducir el contagio y prevenir la proliferación de otras variantes de preocupación cuando más residentes están al día con sus vacunas. Next slide, please. Los mapas de esta diapositiva nos ayudan a ver dónde tenemos las mayores brechas en las tasas de vacunación. El primer mapa muestra la proporción de residentes del condado de Los Ángeles de 5 años o más que recibieron una o más dosis de la vacuna contra el COVID-19 al 6 de febrero. El segundo mapa muestra la proporción de residentes de 5 años o más que fueron vacunados por completo y recibieron una dosis adicional de refuerzo a partir del 6 de febrero. Los sombreados azul oscuro y violeta oscuro representan tasas de vacunación más altas, mientras que los sombreados en amarillo y verde claro representan tasas más bajas. Los círculos rojos marcan áreas donde hay mayores brechas en la cobertura. Al revisar estos, es evidente que hemos mejorado significativamente la cobertura de la serie primaria de dosis requeridas, aunque los niveles varían de forma importante entre las comunidades del condado de Los Ángeles. Por ejemplo, las tasas son mucho más bajas en las comunidades de Compton, Watts, el distrito de Crenshaw, Baldwin Hills e Inglewood, así como en Acton, Castaic, Palmdale, Lancaster y varias áreas no incorporadas en el norte del condado de Los Ángeles. Si necesitan esfuerzos para mejorar la cobertura de refuerzo en gran parte del condado, dado que está particularmente bajo en el norte del condado de Los Ángeles, así como en comunidades de Watts, Florence, Firestone y el área central de Vernon. Dada la correlación entre la cobertura de vacunación y los resultados de salud, algunas de las comunidades con tasas de vacunación más bajas son las mismas áreas donde vimos tasas más altas de casos, hospitalizaciones y muertes por COVID-19. Las vacunas COVID-19 están disponibles sin costo alguno en lugares convenientes como consultorios, clínicas, farmacias y escuelas en todo el condado, incluso muchas de estas áreas en áreas con tasas de vacunación más bajas. A los residentes no se les preguntará sobre su estado migratorio y no se necesita una cita previa en muchos lugares. Uber y Lyft ofrecen viajes gratis hacia y desde los sitios de vacunación, y los residentes que no pueden salir de casa pueden solicitar que se les lleve la vacuna hacia su casa. Para obtener más información y encontrar un sitio de vacunación, los residentes pueden visitar la página en inglés vaccinatelacounty.com o vacunatelosangeles.com en español, o llamar a nuestro centro de llamadas de vacunas al 833-540-0473 entre las 8 de la mañana y las 8:30 de la noche los 7 días de la semana. Next slide, please. Las medidas de seguridad en las escuelas, incluidos los programas de pruebas de rutina y de respuesta, están ayudando a mantener nuestras escuelas seguras para los estudiantes, los maestros y el personal. Esta diapositiva muestra el volumen de pruebas escolares representado por las barras azules y la tasa de casos positivos con base en las pruebas representada por la línea de tendencia morada a lo largo del tiempo. Por cuarta semana consecutiva ha disminuido la tasa de casos positivos con base en las pruebas en las escuelas. Entre el 31 de enero y el 4 de febrero se administraron más de 515,000 pruebas con una tasa de resultados positivos de 2,6%, lo que representa una disminución de cerca del 80% desde principios de enero. Next slide, please. Entre el 30 de enero y el 5 de febrero se desataron 15 nuevos brotes, 7 en primaria y 2 en secundaria, y 5 en preparatoria y 1 en deportes juveniles. Salud Pública está investigando actualmente un total de 56 brotes escolares frente a los 52 que estaban bajo investigación la semana pasada. Dada la gran cantidad de escuelas y el alto volumen de estudiantes y maestros y personal que se encuentran en los planteles todos los días, el número de brotes en ellos es relativamente bajo y sugiere que las escuelas continúan implementando con éxito las estrategias recomendadas que limitan la propagación, entre ellas la aplicación de pruebas de detección y de respuesta, el cumplimiento de los requisitos de aislamiento y cuarentena, el seguimiento a las pautas recomendadas para el control de infecciones y el uso de mascarillas bien ajustadas que proporcionen la máxima filtración según lo requiera el Estado. Next slide, please. La dosis de la vacuna pediátrica COVID-19 para niños de 5 a 11 años, así como los refuerzos para estudiantes de 12 años y más aprobados, se ofrecen sin costo alguno en los puestos de vacunación en las escuelas de todo el condado. Estos son un componente importante, clave de la estrategia integral de seguridad escolar del condado y aumentan el acceso a las vacunas en sitios confiables y convenientes. Desde febrero de 2021 se han instalado alrededor de 6,000 puestos de vacunación en las escuelas del condado de Los Ángeles y casi 1,100 están programados para febrero. Como puede ver en este mapa, la gran mayoría de estos se ubican en comunidades de escasos recursos, algunas de las cuales han sido muy afectadas por la pandemia. Next slide, please. Y aunque mejorar las tasas de vacunación sigue siendo una prioridad, también hemos confiado en otras herramientas para ayudarnos a reducir la exposición y el contagio. Mientras pensamos en las estrategias posteriores a la oleada que se implementarán en breve, queremos señalar que hemos permanecido abiertos durante esta oleada tan dañina porque usamos un amplio conjunto de medidas de protección que ayudaron a disminuir el impacto de Omicron, y necesitaremos continuar usando algunas de estas estrategias después de este pico. También es importante reconocer que nuestro plan posterior al aumento repentino de casos está en continuo movimiento, refleja dónde nos encontramos hoy en la pandemia y nuestra mejor estimación de dónde esperamos estar después de la oleada. Si las condiciones cambian, reevaluaremos y si es necesario, modificaremos nuestras estrategias de mitigación. Una variedad de factores podrían requerir cambios en nuestro enfoque, pero hay dos que estamos seguros requerirán que modifiquemos nuestro plan y estrategias. Primero, refinaríamos nuestro plan si tuviéramos una nueva herramienta que mejore los resultados, como el acceso adecuado a tratamientos altamente efectivos. Actualmente son escasos los medicamentos más nuevos, como Paxlovid, que se administra oralmente. Si pudiéramos garantizar un acceso adecuado a estos tratamientos, esto mitigaría los peores efectos de COVID y podríamos refinar nuestras estrategias. Por otro lado, si surgiera una nueva variante más infecciosa que evada gran parte de la protección de la vacuna y o cause una enfermedad más grave, tendríamos que considerar aplicar nuevamente más protecciones. Entonces, a medida que avanzamos en el periodo posterior a la oleada, continuaremos tomando las acciones necesarias como lo hemos hecho a lo largo de la pandemia. Monitorear la situación y adaptar nuestros planes para asegurarnos de que podamos hacer todo lo posible para protegernos los unos a los otros y a nuestras comunidades. Sabemos que algunos residentes y partes interesadas esperan que se pongan fin a los requisitos de uso de mascarillas, especialmente debido a los recientes cambios del Estado a los requisitos de uso de mascarillas. Salud Pública entiende y comparte este deseo de quitarse las mascarillas y pronto se producirán algunos cambios. Sin embargo, el problema es de tiempo. Los cubrebocas brindan una capa esencial de protección cuando el contagio es alto y nos ayudan a reducir las exposiciones y disminuir el número de casos. A pesar de que las recientes disminuciones, la transmisión en el condado de Los Ángeles sigue siendo alta. De hecho, los casos y las hospitalizaciones la semana pasada en el condado de Los Ángeles fueron más altos cuando el gobernador emitió el mandato de uso de mascarillas en todo el estado el 15 de diciembre, el cual tenía la intención de reducir la propagación. Cuando el gobernador emitió este requerimiento de uso de mascarillas, el condado de Los Ángeles reportó 1,600 casos nuevos y 772 hospitalizaciones. En todo el estado se informaron alrededor de 5,500 casos y 3,600 personas hospitalizadas. En comparación, hoy estamos reportando casi 6,300 casos nuevos y casi 2,500 hospitalizaciones por COVID en el condado de Los Ángeles. Tenemos que considerar que nuestros números de casos son aproximadamente 4 veces más altos ahora que el 15 de diciembre, cuando se emitió el mandato estatal de uso de mascarillas y que la propagación sigue siendo muy alta. Y si bien siempre es importante considerar los riesgos y beneficios personales, Salud Pública también se encarga de evaluar los riesgos y beneficios entre las poblaciones. Los costos del alto contagio no solo los asumen los individuos y no se distribuyen por igual. Y la alta transmisión conduce a graves interrupciones asociadas con la escasez de personal, reducción de la seguridad económica para muchos cuando se ponen en cuarentena o se aíslan sin pago por enfermedad y una mayor morbilidad y mortalidad entre los más vulnerables y que están más expuestos. El COVID-19 sigue siendo agobiante. En el mes de enero hubo más de 841,000 casos nuevos de COVID en el condado de Los Ángeles, incluidos 265,000 casos entre niños. En diciembre, 396 personas murieron de COVID en comparación con 163 personas por neumonía o gripe. Hay incógnitas sobre los efectos de un COVID prolongado y de síndrome inflamatorio multisistémico en niños en términos de discapacidades continuas. Y todavía no tenemos suministros adecuados de los tratamientos disponibles para atender a todos los que son buenos candidatos para recibirlos. Ser cauteloso aún tiene sentido y hacer todo lo que podamos para reducir las altas tasas de contagio es un objetivo apropiado que debemos seguir adoptando como comunidad. No obstante, debido a que el contagio ha disminuido en buena medida, es hora de considerar cambios sensatos a nuestros refuerzos de mitigación. Como señalamos antes, con los números de hospitalizaciones por COVID por debajo de 2.500, creemos que la próxima semana, con suerte para el miércoles, podremos levantar los requisitos de uso de mascarilla al aire libre en megaeventos, guarderías y escuelas. Como se señaló a principios de esta semana, de conformidad con las recomendaciones de los CDC, el uso de mascarillas en la etapa posterior de la oleada seguirá siendo obligatorio al interior de los establecimientos, incluidos las oficinas y los lugares de trabajo, los eventos en sitios cubiertos y los entornos de alto riesgo hasta que se cumplan las siguientes condiciones. Durante 2 semanas consecutivas, el contagio es o está por debajo del nivel de transmisión moderado, el cual es, según lo definido por los CDC, de menos de 50 casos nuevos por cada 100,000 personas en los últimos 7 días. O las vacunas han estado disponibles para niños menores de 5 años durante 8 semanas y no han surgido informes de nuevas variantes de preocupación que circulen significativamente y que amenacen con la eficacia de la vacuna. Donde existan reglamentaciones federales y estatales, también se seguirá exigiendo el uso de mascarilla. Esto incluye cuando se viaja en transporte público y en terminales de transporte según lo exijan las reglamentaciones federales y los requisitos estatales de uso de mascarilla al interior de las escuelas de transición a grado 12, guarderías y entornos juveniles, centros de atención médica, instituciones correccionales, refugios para personas sin hogar y para atenciones de emergencia y centros de enfriamiento. Las jurisdicciones locales no pueden ser menos restrictivas que el Estado o el gobierno federal, por lo que es importante tener en cuenta que el requisito de uso de mascarillas en las áreas interiores de las escuelas sigue vigente según la orden estatal. Los sitios también deberán seguir cumpliendo con los requisitos de uso de mascarillas aplicables que se incluyen en las órdenes del oficial de salud del Estado y del Condado de Los Ángeles o en las comunicaciones a las instalaciones de atención médica. Pediremos a los empleadores que continúen brindando a los empleados, a los trabajadores, mascarillas de alta calidad y que se ajusten bien si sus labores los ponen en contacto cercano con otros trabajadores o el público. Hasta que la transmisión sea mucho menor, también continuaremos recomendando que nos dejemos puestas las mascarillas siempre que estemos en contacto cercano con otras personas en espacios cerrados o al aire libre llenos de gente. Sabemos que durante la pandemia las empresas y organizaciones han tomado precauciones adicionales de forma voluntaria para proteger a los trabajadores, los clientes y al público. Ellas continuarán teniendo la discreción de exigir el uso de mascarillas a los trabajadores, clientes y el público. Como hemos compartido muchas veces, el uso de cubrebocas es una de las acciones más fáciles que todos podemos tomar para reducir la propagación de COVID y agradecemos a los residentes por continuar tomando este sencillo paso para protegerse a sí mismos, a los trabajadores, a quienes no pueden vacunarse y a quienes corren un alto riesgo de enfermarse gravemente. Sabemos que nos preocupa que hayamos establecido una meta ambiciosa para rescindir los requisitos de uso de mascarillas en interiores. La verdad es que durante 4 meses del año pasado, desde el 18 de marzo de 2021 hasta el 10 de junio de 2021, perdón, hasta el 10 de julio de 2021, estuvimos en la categoría de contagio moderado todos los días y creemos que es posible llegar nuevamente a este nivel con bastante rapidez. Nuestra tasa de casos está cayendo a un promedio de 3,5% cada día. Y si podemos mantener este ritmo, alcanzaríamos la transmisión moderada en 25 a 30 días. Por supuesto, debemos continuar con las medidas de sentido común que reducen la propagación de COVID-19 hasta que alcancemos un nivel de riesgo aceptable para el condado. Estos incluyen vacunarse y recibir el refuerzo, usar mascarillas bien ajustadas cuando se lo recomienden, seguir las pautas de prevención de COVID en las escuelas y lugares de trabajo y quedarse en casa si está enfermo o ha estado expuesto al COVID y seguir la guía de salud pública de asistir si va a asistir o va a hacer reuniones. Next slide, please. Los requisitos de verificación del estado de vacunación continuarán haciéndose en los megaeventos, tanto en el interior, tanto en interiores como al aire libre, y para ingresar a las porciones interiores de bares, discotecas, clubes nocturnos, bodegas, cervecerías y destilerías, hasta que la transmisión sea mucho menor. Next slide, please. Para terminar, queremos señalar que en todo el condado muchos dedicaron tiempo la semana pasada para celebrar los logros extraordinarios de los RAM y que estamos a solo 3 días del Supertazón. Damos la bienvenida a los fanáticos de la NFL al hermoso condado de Los Ángeles y estamos entusiasmados con la oportunidad de este año de albergar el Supertazón y estar completamente abiertos. Pedimos a todos que tengan cuidado para minimizar los riesgos. Y ya sea que asistamos al partido en el estadio SoFi, a un evento previo al partido o a una reunión en la casa de alguien, muchos de nosotros pasaremos varias horas comiendo, bebiendo, animando y gritando con personas de varios hogares, debido a que todas estas son condiciones que pueden facilitar la propagación de COVID-19. Les pedimos que sigan algunas recomendaciones de sentido común que pueden reducir la posibilidad de que se expongan o expongan a otros al COVID. Todavía tiene sentido vacunarse o recibir el refuerzo antes del juego. Considere hacerse una prueba rápida de COVID-19 lo más cerca posible del comienzo del juego como precaución adicional, especialmente si se reúne en el interior o con personas que no están vacunadas o que corren un mayor riesgo de enfermarse gravemente. Si después del juego cree que ha estado expuesto a alguien con COVID, considere hacerse la prueba nuevamente. Si está enfermo o tiene una prueba de COVID-19 positiva, no asista al juego, evento o reunión. Quédese en casa lejos de los demás y únase virtualmente a las celebraciones. Si está organizando una reunión más pequeña, es mejor que grande. Trate de reunirse al aire libre si es posible, ya que afuera es más seguro que adentro, especialmente cuando se quitan las mascarillas para comer y beber. Si eso no es posible, haga lo que pueda para mejorar el flujo de aire en el interior. Si es seguro, abra ventanas y puertas, use ventiladores y purificadores de aire portátiles y deje correr el aire y continúe ventilando el espacio después de que sus invitados se hayan ido. Lávese las manos antes y después de preparar comida, tenga disponibles desinfectantes para manos y opte por servir los refrigerios en platos individuales. A menos que todos estén al día con sus vacunas, mantenga una distancia al comer, especialmente cuando estén interiores. Si va a ir al juego o a un bar o restaurante para ver el juego, tenga cuidado y siga los requisitos de uso de mascarilla del lugar. Y si está en el interior, use cubrebocas, más protector, y si tiene un alto riesgo de infección o una enfermedad grave, use una mascarilla de alto nivel que le quede bien, como una N95, KN95 o KF94. Si está en una reunión concurrida al aire libre con personas no vacunadas, individuos cuyo estado de vacunación no conoce, o personas con mayor riesgo de enfermarse gravemente, también tiene sentido usar mascarilla al aire libre. Y por favor, no conduzca en estado de embriaguez hacia y desde ningún lugar. Para aquellos que asistan a eventos en el estadio SoFi o en la experiencia del Supertazón, en el centro de convenciones, tenga en cuenta que deberá usar mascarilla y verificar su estado de vacunación o proporcionar un resultado negativo de la prueba antes de ingresar a estos eventos. Estamos agradecidos con la NFL y el estadio SoFi por sus esfuerzos para facilitar que todos estén lo más seguros posibles. Gracias a la NFL, las pruebas rápidas y las mascarillas están disponibles en ambos sitios. Si se vacuna en el puesto de vacunación en donde se va a realizar la experiencia del Supertazón, recibirá una entrada gratis al evento y todos los asistentes recibirán un juego de prueba en casa para usar el domingo antes de reunirse para ver el gran juego. Agradecemos a todos por lo que están haciendo para cuidarse los unos a los otros. Sabemos que este es un momento particularmente difícil y muchos quisieran que levantáramos las protecciones de seguridad más rápidamente. Como ha sido el caso a lo largo de la pandemia, apreciamos las diferentes experiencias y perspectivas de todos los residentes y hacemos todo lo posible para escuchar las preocupaciones y utilizar la ciencia como guía, como un camino a seguir, centrado en proteger a los más vulnerables, nuestros trabajadores esenciales y nuestro sistema de salud. Dado donde estamos y el riesgo continuo asociado con las altas tasas de transmisión, debemos continuar usando protecciones de seguridad sensatas. Muchas gracias y hasta la próxima.
Thank you so much, Monica, and thank you to everyone who joined us today. If you have a media question for us, you can send that to our media inbox at media@ph.lacounty.gov. Thank you again, and we'll see you next week.